Thanks for staying with us. Health Minister Joe Phaahla says early indications are that Gauteng has now reached the peak of its fourth wave Covid-19 outbreak, while the numbers in the rest of the provinces are continuing to climb. Phaahla says the fourth wave, driven by the Omicron variant, has continued to spread rapidly across South Africa. The minister is providing the latest update on the country's battle with the pandemic this morning. Let's get an update now. Speak to Higher Health CEO, Professor Ramneek Ahluwalia. Prof, always great to have you on the program. So, early indications that Gauteng may have already reached and passed its peak, but we're far from out of the woods, aren't we?
I think so, Tembi, absolutely. I think the infection, this is a very contagious new variant, but there are very promising signs compared to what we have seen in Delta or the Beta variant that hit South Africa for its second or third wave. This is clearly the signs that, a lot of South Africans in Gauteng province became infected to this Omicron variant. But clearly the number of hospitalizations are still far comparatively lower, as much as they're rising on a very high pace, but they're still not rising to the level we saw in the Delta variant or in the Beta variant, and specifically comparative to the third wave, which has just crossed over about a few months back. And what it's clearly, Tembi, is giving us is there are three things working in our favor at this moment. And we do not know as a scientific world what are the real factors which will come as the data will grow, and we're just 3 weeks into this Omicron variant. But there are three things that we are clearly watching that's happening. One, that 70% of South Africans had natural immunity, which means they were infected due to the second variant or the third variant, which is the Beta or the Delta or the original coronavirus, which actually predominantly infected so many South Africans previously, which means somewhere the natural immunity is holding its importance. The second thing is vaccinations. Clearly, it's clear indication towards, we see, and unfortunately people are still dying of coronavirus. Omicron is still fatal to people with comorbidities or older people or specifically non-vaccinated people, as 90% of the deaths are still related to non-vaccinated people, clearly showing that the T-cell immunity that the vaccines produce, which is fully vaccinated people, somewhere you get breakthrough infections. This variant clearly has escaped the vaccine immunity, but somewhere down the line when the viral load starts growing, our T-cell picks up and overcomes it. And the third part is the possibility, too early to say, but the virus is losing its virulence. So, but either way, promising signs, it's showing that our immunity is now able to slightly overcome this Omicron, as much as hospitalizations are growing, not to what we would have expected.
And according to the health minister, we've got about 7,600 people currently in hospital, all of them, majority of them, I should say, not dealing with the worst kind of illness. But that also then corresponds with a decline in the number of people who are being vaccinated, because the minister says when news of Omicron's detection was announced, people then rushed, so to speak, to get vaccinated. But now that they think it's less serious, people seem to be staying away from vaccination centers.
I think I really urge South Africans who are watching your show and Tembi that vaccinations are predominantly a huge game changer in even the trajectory of our future waves that might hit South Africa due to this coronavirus, because this is a mutating virus. What vaccines are going to do is eventually, even if you see currently with Omicron, the variant does try to escape our natural immunity or our vaccine immunity, but eventually the vaccine immunity eventually takes over the virus. So you get infection, you get a mild infection, you get a moderate infection, but you don't end up in a hospital or being dead or in a death spree, which we saw in the previous waves, which means the fatalities are reduced, which is a big sign of us to fight this virus. And second thing is, more and more South Africans will get vaccinated, will not allow this virus to sit and mutate in a human body that it loves to mutate in, which means the transmissibility will reduce, infections will reduce, as well as severity of the infections will reduce. And I think that's what the vaccinations are helping us with. And we need to continuously promote. And if the signs of lower vaccinations are happening, these are not good signs for our future, not just with Omicron, but our future in dealing with coronavirus.
And Doctor, how much of a benefit do you think we've drawn as South Africa from the fact that majority of the over 60s who are highly vulnerable, as we've seen in the 3 previous waves, 66% of them are vaccinated? Do you think that's played a key part in sparing us the worst from this variant?
Including Omicron, irrespective, scientists prove it's going to have its lower virulence. Even in flu virus, a normal flu virus that happens in the flu season, it always affects the elderly and it affects the people with comorbidities because your immune system is already suppressed or lower. So the virus finds it's very easy to multiply quickly and produce a lot of viral load, defeating, because all the virus is trying to survive in our body is by defeating our own immune system. So the vulnerable will always be the older people, the people with comorbidities. But do not forget, young people have a lot of comorbidities. So any virus, irrespective it's mutating or lowering virulence, will have a huge effect on the older people. And specifically, vaccination in older people will produce that T-cell immunity and that immune system. Even they will have higher chances of having a slightly moderate or severe infection, but their own body will eventually, with the help of vaccine, overcome it. And that's what is helping South Africa currently.
And in terms of, I want to go back to the issue of hospitalizations because that has concerned you in particular. Yesterday we had on the program the Deputy Director General in the Health Department, Dr. Nicholas Crisp, and he was saying the measure as far as the level of risk in the country is weighed against the burden on hospitals. Scientifically, is that the wisest way? Because throughout the pandemic we've battled with when to close. Do you do it too early? Do you do it too late?
You know, Tembi, every life is precious. Every life is a family of anyone. So this is a very difficult question to any person, irrespective you're from a scientific world or because at the end of the day, life is not only about just the disease itself. Life is about earning an economy. Life is about finding a bread for his children. And these are all the factors one has to see before imposing restrictions on humans around. And I think where we have to watch is the healthcare workers and the hospitals as a predominant factor, because that population is the population that eventually will decide whether how much restriction can South Africa needs to put in, because we can't overwhelm them and we can't overwhelm our hospitals at this moment, because if that becomes, the death rate starts increasing, because if people don't get early oxygens, people don't get hospital beds, we are at a risk. So it's a balance that you have to. But what we need to seriously promote is to every South African is this disease is still an airborne disease. It still requires ventilation. It requires a mask. It requires a physical distance. Nothing has changed, even though the variance is changing. But the virus still remains to be an airborne and move from one individual to the other. Having a block or taking own precautions will only assist the country, will only assist our hospitalization, and only assist for any president to put any restrictions. So I think I agree with Nicholas. The two big indicators will always be the hospital overwhelming in our healthcare workers at this stage, and that will always be the defining factor.
Professor Ramneek, Ahluwalia, always great to speak to you, CEO of Higher Health.